everybody, I am Dr. Sunanda Chava. Today I would like to talk about tetany. So, what is tetany? Tetany is a symptom characterized by the involuntary contraction of the muscles that usually results from low calcium levels in blood. It usually occurs below 5 or 6 milligrams per deciliter of calcium in the blood. So, what is the normal calcium level? The normal calcium level is 9 to 11 milligrams per deciliter. Usually, below 8.8, it is considered to be hypocalcemic. So, what are the common symptoms of tetany? The common symptoms of tetany are numbness around the mouth, muscle spasms and cramps, and paresthesias affecting hands and feet, seizures, and then mouth opening difficulty. It might get closed, difficult to open the mouth. That's called trismus, and some fits. Okay. Now, tetany also could occur due to less blood magnesium and potassium levels and increased phosphate levels. So in this condition, when there is less calcium, there is increased neuromuscular excitability due to excitability. The severity will vary from asymptomatic or that's not causing any problem, or mild or moderate or severe or permanent damage like heart failure, pain in the breathing system, pain and respiratory failure, and then fits and all. So, what are the causes of low calcium? So, the causes of low calcium are, as we know, vitamin D is essential for absorption of calcium. So, low vitamin D can cause hypocalcemia, that is, less calcium in the blood. Sometimes the calcium might be less in the diet, that is, we take less calcium rich food. And there might be some malabsorption problem, that is, the calcium might not get absorbed into the body, either in the intestine or in the kidneys, in some conditions like sprue, and then gastrectomy or removal of stomach, and then also liver and kidney conditions where the provitamin D is converted into active form by hydroxylation in the liver and kidney. So this indirectly affects the calcium level absorption by decreasing the vitamin D levels. Post-operative tetany, then hypoparathyroidism, Graves' disease or autoimmune hyperthyroidism. It can also occur due to hyperventilation, secondary to anxiety, resulting in tetany, because in hyperventilation there is less carbon dioxide levels that will alter the calcium albumin combining capacity, so there will be less calcium. It can also occur in diuretics. And What is the difference between tetany and tetanus? Tetany is caused due to low calcium levels. There is neuromuscular excitability. Because of that, there is action potential generated more, and there is a lot of contraction, and this persistent contraction of the muscle will lead to spasm of the muscle and all. So this happens due to low calcium in tetany. So what is tetanus? They are interchangeably used by some people. Tetanus is the infection which is caused due to toxin or poison released by Clostridium tetani bacteria. So there might be rhizus sardonicus or laughing face, and there might be bowing of the body, where only sometimes in severe cases only feet and the back of the head touches the floor. That's called opisthotonus. So these two occur in tetanus. So in tetany, there might be trismus or mouth opening difficulty. There might be dental changes, that is, the roots might not develop properly. There will be less mineralization of the enamel in the tooth, causing soft enamel. If you put the probe and just try to scrape the tooth, there will be enamel or tooth material coming out along with the probe. So soft it is. And then soft nails, soft bones, osteoporosis, bending of the bones due to soft bones, as we see in case of rickets and osteomalacia. There might be laryngospasm, that is, vocal cord will become paralyzed, or they might get spasm, so that's called laryngospasm. And there might be changes in the brain cells also, causing depression and all. So, what are the types of tetany? There are two types of tetany. One is manifest, the other one is latent. Manifest type of tetany occurs in postoperative parathyroid tetany, and in the latent tetany, it occurs due to hyperventilation, where there is less carbon dioxide levels, causing less calcium albumin binding capacity, and there will be magnesium deficiency in case of latent tetany. And what are the two classic signs of tetany? The two classic signs of tetany you see for tetany by doing some two tests. One is for two signs, that's called Chvostek sign. The other one is carpopedal spasm or Letrozos sign. So in Chvostek sign, as we know, the facial nerve gives branches in the parotid gland. So it supplies the muscles of the face. When we tap 2 centimeter in front of the ear on the gland, there will be twitching of the nose and lips, sometimes eyebrows also. This is called as Chostak sign. And the other one is carpopedal spasm. In carpal spasm, uh, there is a test called Letrozos sign. In carpopedal spasm, there will be obstetrician's hand and also spasm in the feet. There will be contraction of the distal muscles of the hands, that is carpal spasm, with extension of interphalangeal joint and adduction of flexion of metacarpophalangeal joints and feet, that is pedal spasm, and is associated with tingling around the mouth and distally in the limbs. There is tingling in the limbs. So how do you do the Letrozos sign to elicit the carpal spasm is, here carpopedal spasm is carpal spasm and feet spasm. Carpal spasm you are going to elicit by doing Letrozos sign. So in this, what are you going to do is, you are going to occlude the brachial artery here by putting the BP apparatus cuff and then elevating the pressure, elevating the level somewhere between systolic and diastolic, and keeping it like that for 3 minutes, 2 to 3 minutes. So there will be spasm, there will be spasm of the fingers of the hand, in that hand. So this is called as Letrozos sign. It is seen in tetany. So this Chvostek sign and carpopedal spasm, Letrozos sign, uh, they are seen in tetany. So what is the pathophysiology of tetany? So there is, because of decreased ionized calcium levels in extracellular fluid, there is increased permeability of nerve membrane to sodium ions. So there is depolarization, there is increased action potential that will cause nerve hyperexcitability and contraction and spasm. So what is the normal calcium level, normal calcium to be taken in the diet? In the recommended daily allowance, it is 1000 milligrams for adults, and for menopausal people, like in females more than 51 years of age and males 71 years of age, the need is 1200 milligrams. So for treating tetany, they have to eat lot of calcium rich food like milk, dairy products, broccoli, beans, fortified cereals, fortified juices like orange juice, figs, nuts and seeds like almonds, sesame seeds, sunflower seeds, chia seeds. So sheets have boron which metabolize calcium. They can be added with oatmeal and cereals and can be had and can be consumed. Sweet potatoes which are rich in calcium and also potassium, vitamin A and C. So how do you treat tetany? You have to treat the tetany uh, dep- uh, depending on the cause. You have to remove the etiology. If the calcium is less in diet, include it. If there is malabsorption, treat that. Then give the calcium supplements, and then you can give IV calcium gluconate in acute condition emergency, and then arrhythmias, and then kidney failure, liver failure, heart failure, and all treat accordingly. And then you have to main thing is we should need you should see what is the cause of the calcium deficiency. So that cause has to be corrected, and IV calcium has to be given in case of has to be given. So we I have covered the important points in tetany. Hope this would be helpful to you. Please, if you like it, please press the like button and subscribe for my channel. Thank you very much. Meet you in the next video. Thank you. Bye.